Hello, everyone. Tim Welty here again. Imagine that. Uh, well, today was something different, I have to say. I'll turn on the light so you can see me. Today, I had to deal with the mental health department. Yesterday, I went and saw my doctor. Okay, and my doctor was wanting to talk to me more about my medications than anything else. I told my doctor about what was going on with me, about why I'm going to be homeless, and my doctor told me to see a caseworker immediately. So I went out and waited for a caseworker like my doctor told me to go sit and wait, and the caseworker will be with you shortly. I waited for over an hour. No one in MHMR came to help me. I went and I got somebody and said, "Hey, I've been waiting for over an hour." It was over an hour, probably about an hour and a half, hour and 15 to hour and 30 that I was sat there and waited. And they said, "Let me check." So I was getting a little bit of help there. Let me check. Then they came back and said, "Well, no caseworkers are available today. They're all booked up." There was two people in the waiting room and no people in the room I was in. Well, I take that back. There were two people in the room I was in also. So they told me to come back at 2 o'clock today. Now, mind you, when I walked in, there were only two people sitting waiting to see someone. They told me, "Mr. Walter, you can go on back." And so I went on into the back waiting area where it's normal. It's kind of like the front waiting area is like a pre-screening of you, and if you're if they can allow you to go into the back area, is kind of how it is. And God help them, they put up with a lot of people, and I do not raise my voice. I do not get mad at them. I try to get my point across, of course, but without trying to hurt anyone's feelings. Well, I guess I hurt somebody's feelings today because I went into the back like they told me to. And while I was sitting there, I thought, I better record this. And I took 15 minutes. Well, I started recording. And when Ashante, the office manager came to me and said, uh, "Can I help you?" Not that she knew my name or anything, and I know she does, or now she does for sure. Uh, and I said, "Yes, ma'am. I have an appointment for 2 o'clock." And Miss Welty, you don't have an appointment for 2 o'clock. I said, "Yes, ma'am. Yesterday when I was here and I talked to my doctor, my provider said for me to see a caseworker immediately." I sat and waited for over an hour, and then I was given an appointment time for today, which today is Wednesday. And so I went today, uh, Wednesday the 6th of November. I uh, arrived on time. They sent me into the back, talking to Ashante, recording at this time. Okay, and we get all the way up, and she said, "Come with me and let's go look and see." Or so she might not have said that no appointment today at that time, but I had an appointment scheduled for today. and she was part of the group that were talking to me, and she, being the office manager, should be aware of what's going on. Well, she saw my camera on, and she said, "You can't film in here, HIPAA laws." And I said, "Okay, I'm not filming you, I'm just filming myself. I'm not taking pictures of anything else in here. But you have your camera on." "I did take a picture of you, but I'm not filming you, and I have not gotten any record on my phone of any other person's personal information or rights." Which is true. You can look at the video. I'll post it. Well, I had to turn off my camera because she made me, and I went to the front where the evaluation area is again, and they told me, "Mr. Welty, you do not have an appointment today." And I tried to let them know that my doctor, my provider, said that I needed to talk to a caseworker yesterday, and uh, today is when an appointment was set up for me. So I'm supposed to see someone today. This has happened to me before. Okay, so I was at caseworkers. Okay, so no caseworker today. And I talked to them, trying to let them know, trying to get them on my side, to look at my doctor's notes, to look at my treatment plan, that I needed to speak to a caseworker. Very important, my doctor told me to. They're supposed to go by what the doctors tell them to do. They did not do that today. They didn't do it yesterday. And I've had this problem before. They told me that the only appointment that they can give me is Monday. Monday is my move out date, and that's because I'm being evicted for going by my treatment plan. I had one guest stay with me one night, and to because I was suicidal that night. Had all kinds of bad thoughts that I wasn't loved going through my head, and I needed somebody there by me to let me know that I am loved. Otherwise, all the voices in my head were talking me into killing myself and making me feel that I'm not worthy and not worth anything. And it's a horrible, horrible feeling, especially alone. But with someone with me, I can overcome. And so I did have someone with me that night. The next day, or actually it was a few days later, Brandy comes, knocks on my door, and gives me pushes my door open, steps in, and gives me pushes my door open, steps in again, against the law, gives me my first write-up, and then hands me, and this is an eviction. You have until the 11th of November to get out of here. So I was trying to explain to the people that in the mental health today that the information in my treatment plan must not have been sent to Brandy, who's over housing. And they're like, "We don't have anything to do with housing." Well, help me out here, people. If it's MHMR, mental health, mental retardation, I'm living on campus here, it means I have mental health problems. Uh, I try to follow the rules to the best of my ability, and if I don't understand something, I just don't understand it. And don't evict me for that. Help me out. I might be a little bit retarded too. I don't know. But I have a lot of things wrong with me. PTSD. So it's hard for me to get to know people. Uh, ADD, ADHD, severe depression, psychosis, seeing people, severe pain. It's hard. It's hard as hell to live with just that part of me. I've overcome and tried to get myself right. I went to the hospital and I've been trying to get myself right, taking the medication as they prescribe. But when everybody else in MHMR is not working together and helping the clients, it's kind of like they say, I'm doing good over here, and I'm doing good over here, and I'm doing good over here, but they don't communicate with each other when they should all be doing good together. And that's what our lawmakers need to understand is that, especially in a state run facility or state uh, appropriated, because appropriated funds help run this place. And you have people with mental health needs that live here, need for the mental health department, the physical health department, and the housing office to all work together. Even the crisis office needs to work in all of this just to make sure a crisis does not occur. So they could send people in to talk to us, to advocate with us, to show us what programs are available. No one shows me the programs here. Uh, I don't really know how to get the help myself. Uh, I've learned a lot of things from just the people that come here, the other patients, but from staff, no, they have not given me any help. They show favoritism to some people, and that's wrong. Uh, I'm not calling this any kind of race issue or anything like that. It's just that some people get favoritism and some don't. Uh, because I've literally seen other residents here in my building have people over night and nothing has happened to them. I've seen people have someone overnight and they've been written up for it and given a second chance, sometimes multiple times. And my first time, because of my treatment plan, I needed someone to stay with me and help me. I get a write up and evicted at the same time. That's not fair. And something's wrong. Something is really, really wrong with this situation. So, if you can give me some thoughts, some inspiration, you can pass this on to a lawmaker or someone you know that has influence that can help me. I would appreciate it. Thank you very much.